Welcome to Dear Dr. Mal. Today I'm going to talk about natural prevention and treatment for gum disease. Later on in the episode, I will give you tips on how you can keep your gums healthy for the rest of your life. Did you know that over 50% of Americans over 13 years old suffer from some form of gum disease? I am sure you've been told in the past by your dentist that you need to do a better job flossing and taking care of your gums. In fact, your gums are just as important, if not more important, than your teeth, because you can have this set of great teeth, but poor gum health can lead to the loss of all your teeth. So all that whitening and care of your teeth may not mean much if you don't have good gums to hold them in place. That's a real problem. Gum disease can lead to serious health issues. Now, mild gum disease or gingivitis simply means inflammation of the gums. But more serious gum disease or periodontal disease is when plaque builds up and the treatment requires the dreaded deep scaling, cleaning, or even surgery. About 45% of people over 60 years old suffer from some form of periodontal disease. And why does this matter? Well, studies show that there is a strong link between that and other serious disease. Periodontal disease can vastly increase the risk of heart attacks and pancreatic cancer. You see, the bacteria that infect gums can also irritate the walls of the arteries and induce clot formation, leading to heart attack. Infection and inflammation can also cause an increase in the production of carcinogens such as nitrosamine in the mouth, which can increase the risk of developing pancreatic cancer. Okay, now that I got your attention, what can you do to ensure good gum health? I got 5 tips for you. First, avoid sugars, refined and processed foods, and highly acidic foods including coffee, soda, and alcohol. Also, reduce your consumption of spicy, greasy, and deep-fried foods, as well as sticky sweets like caramel candies, for example. And that includes smoking, too. Remember, the bacteria in your mouth needs feeding, and the more sweets and refined carbohydrates you eat, the more bacteria is going to thrive, which is bad for your gums and your teeth. Number 2, brush, floss, and rinse regularly. I know this sounds like common sense because you already know it and do it, but actually you may not be doing it properly. Brush with an electric toothbrush and be sure to brush under your gums. Now, no one, including the dentist I saw, told me that I needed to brush the space between my teeth and my gums until I was well in my 30s. Now, floss to get the food out between the teeth, which feeds the bacteria that infect the gums. And rinse with baking soda to alkalize your mouth, which makes it unfriendly to the bacteria. I personally take it a step further and use a half hydrogen peroxide and half water mouth rinse to kill off the bacteria in my mouth. And third, massage your gums. The gum tissue needs blood flow to maintain its health. So besides using a rubber tip to massage between your teeth regularly, I suggest using essential oils comprising of wintergreen, eucalyptus, and fennel to help stimulate tissue circulation and regeneration and healing from inflammation. These oils are found in the tension release roll-on from dowstar.com. Just put it on your clean finger and massage away at your gums. A bonus, it also freshens your breath. Fourth tip, take your omega-3 fatty acid supplements. Now, these essential fatty acids from fish, flaxseed, or borage seeds act as anti-inflammatory agents to block specifically periodontal inflammation, according to published studies, and that demonstrated significant improvements among those patients with serious gum disease who were treated with fish oil or borage oil. Number 5, relax and get more sleep. A healthy immune system is key to good oral health. People who suffer from insomnia or chronic stress are more likely to develop periodontal disease than others. That's because when you're stressed or don't get enough sleep, your body produces cortisol, which increases inflammation throughout your body, including your gums. I hope you have enjoyed today's episode and found it helpful for your gum health. Tune in next time when I'll be talking about the pesky problem of scalp dandruff and how to get rid of it naturally. Until then, live long, live strong, and live happy.